is this doesn't make sense. Why would they pass a bill that deliberately brings pain? I mean, the worst kind of pain, right? When you're sick or when your child is sick, the inability to get basic health care, to get well, I mean, there's an inhumanity about that. There's an inhumanity about that. And to intentionally make people go through that gut-wrenching decision of whether you're going to continue to pay your Affordable Care Act premiums, which are going up by 75%. For some families in Florida will double, triple, or quadruple, or pay your mortgage, or pay your rent, right? That's a decision nobody should have to go through. So why are they doing it? Tina said why they're doing it. They're doing it so that they can save a bunch of money to help pay for tax cuts for billionaires, millionaires, and corporations. The richest people in this country, because of the big beautiful bill, are going to get a new tax cut of $270,000. Right? I bet you nobody in this room knows what it's even like to exist on $270,000, and that's the new tax cut that these folks are going to get for a person, right? So it's the biggest transfer of wealth from the poor and the middle class to the rich in the history of the country. It's deeply immoral, and it could end up collapsing our healthcare system, because when you throw that many people off of healthcare, they're not the only people that get impacted. It makes it really hard for hospitals and clinics and health centers to keep their doors open. And so even if you have healthcare, these changes are going to hurt you and your family as well. So thank you for welcoming us here. Thank you for being willing to talk to us and tell us your stories. Again, we're sorry that we have to be here, but this fight matters. As you know, the government is shut down right now, and what Democrats have said is that we want to get the government open, but not with an immoral budget that throws millions of people off their health care. We're not asking to fix the entirety of the broken healthcare system. We're just saying, if we're going to fund the government, let's fund the government that doesn't result in the kind of devastation of the healthcare system that is planned under the current trajectory. So it's also important for us to be here at this moment where we're involved in a pretty big fight. Are we going to help the billionaires and the corporations, or are we going to help regular people throughout the country, but in South Florida as well? Thanks to Elizabeth and her team for helping to, and Tina's team for helping to organize it. Let me introduce you to a great fighter on behalf of working people in this country, Elizabeth Warren.
Thank you, Chris. Thank you, Tina. It's great to be here with people who are willing to stand up and fight. But I also want to say what an honor it is to be here with people who are willing to come forward and tell their stories, people who are on the front lines in this fight. We are deeply grateful to you. We're here today because Donald Trump and the Republicans in Washington would rather shut down government than help make health care affordable for more Americans. It's just that straightforward. We're here particularly in Miami-Dade because you're ground zero for absorbing the pain from the Republican cuts. You are the ones who will lose more people off healthcare altogether, and more people who will see their premiums go up than any place else in the country. And understand this, for everybody who's saying, yeah, but I'll be okay. I get my insurance through my employer, I have it some other way. Nope. Once you got this kind of pain pushed into the system, it will touch everyone. It will touch everyone who has to go to the emergency room and discovers that the lines are longer because people who would have taken the baby to the doctor's office to have the fever and the pulling at her ears checked out is now in the emergency room because she no longer has health insurance coverage, and she waits until it's a mess and ends up there. Same thing for the person who doesn't have the lump checked out. Same thing for the person who fell and it kind of hurts, but they kind of are okay. All of it is going to echo through the system. And every one of those hospitals that's already stretched right to the breaking point and now has more care that they've got to give out because people are in pain, because people have need. Those hospitals are the ones that, canary in the coal mine, First, they close the labor and delivery. Then they start closing the emergency room. Then they start handling this service and that service. And that means, again, for everybody in the region who needs access to healthcare, you got to drive further, you got to wait longer, you got to search harder for the care that you need. Look, we're not here to defend the current healthcare system. I think the three of us would say pretty openly, it's a broken healthcare system. There's too much profit that's going to giant insurance companies and pharmacy benefit managers and big pharma. But this is not the way to fix the healthcare system. Knocking millions of our families, knocking millions of our brothers and sisters off their healthcare coverage, and then watching that wave make it through the healthcare system is a recipe for disaster. So we are here together to push back. And I want you to understand what pushing back means right now. We are the ones who are willing to stand up and just say to Donald Trump and the Republicans, we're not going to sign off on a budget that destroys America's healthcare system, that knocks millions of Americans off their healthcare. We are not going to do that. So I just want everybody to notice, Donald Trump has decided to up the ante. Not only has he said we're not going to negotiate over that, he says he's going to put another chip on the table, not follow the law, and say that if the Democrats won't knuckle under, he's going to say, let's take 15 million hungry children and deny them the food they need under the SNAP program. 1 million veterans, deny them the help they need. And 6 million seniors, just knock them off the help they need. That is not what America is about.
That's right.
We are not here to trade off hungry people for sick people.
That's right.
We are here to say that in America, I just want to say what an honor it is to be with you and to be with people who share the view that nobody should go hungry, not in America, that nobody should have to worry about whether to pay rent or pay for health insurance. And by damn, nobody should have to go bankrupt over a bad medical diagnosis. That's why we're here, Democrats.
I'm going to invite you to speak to the Gators. But as we, right, it's about impact on people's real lives. And that's why I'm so grateful to just 3 of the millions of Floridians who are enrolled in the ACA who are feeling this in one way or another. And so first, I'd like to introduce Francoise.
Sure. Thank you. First of all, I want to thank the senators for being here and for just being the voice in the Senate for us, because we really need you. Okay, I've been living in South Florida for over 40 years. And I've seen things just progress and things didn't work out, but I'm here to share my story on the ACA. I'm going to tell you my age. I'm 63 years old, so I'm 2 years shy of my Medicare insurance. I'm a single mom. I have a 20-year-old daughter in college. So ACA is really important to me. I have a family history of heart disease. So therefore, I need to be able to go to the doctor at least for a checkup and a complete blood count at least once a year. So I really rely on ACA. And my daughter being in college also, one of the requirements of being in college is that she has insurance. If you don't have insurance, they purchase an insurance for you and just tag it on your account. So I'm a single mom, I'm self-employed. And before ACA came about, I spent 25 years without insurance. Um, I could never keep a 9 to 5 job because I had to take care of my parents and a brother that was paralyzed. And in that process, I became a mother. So I have 4 people relying on me. There's no way I could work from 9 to 5, heading to the emergency rooms at midnight, at 2 o'clock in the morning, not sleeping because of a mother with dementia that's up all night. So therefore, I'm one of the individuals that really needed ACA. So now I get to go to the hospital, but with the cost of living in Miami-Dade County, which is extremely high, and the cost of food. And the other day I went online to check to see what my premium would be. It went up more than 250%. So now I have to decide food or my premium. Okay, so and I'm not only here for myself, I'm here for the 24 million people in this country that are on ACA. I'm also here for the Miami-Dade County people that are on ACA, 1 million plus, right? And what that is going to do to our economy in Miami-Dade County. ACA provides jobs for us in our county. And we rely on tourism and healthcare in this county. So I'm afraid to see what's going to happen. Okay. And I want to just thank you for being here again, taking the time out of your busy schedule to think of Miami-Dade County. Thank you.
My name is Kara, and I'm not going to stand up because I'm nervous. Be comfortable, it's all okay. My name is Kara Farley, and I'm from Boynton Beach, Florida. I qualified for an ACA plan with a tax credit subsidy for myself and my husband. Prior to this, I didn't have insurance at all. Back in 2008, I had a hearing cancer diagnosis. I was diagnosed in an emergency room where I went with pain symptoms. I had to have all of my treatment done without insurance, which sent me into medical debt for years. Oh, sorry. My husband is type 1 diabetic who also suffers from seizures. So we lived our life with no insurance, budgeting for the lowest cost insulin that we could afford. It didn't work for him. He spent many times in the emergency room with hypoglycemic episodes being treated. In 2021, we qualified for a tax credit subsidy through the Affordable Care Act, and it's made an everlasting difference for us. My husband is on a continuous glucose monitor now. He hasn't been to the emergency room with a diabetic episode in over 4 years. And in 2024, I was diagnosed with a malignant melanoma that I'm still going through treatment for. And losing this would be devastating to us. I did check on the marketplace and our insurance is going up over double what we're paying now just for the premium. Double. On top of an increased deductible and out-of-pocket expenses that go along with that. And I honestly don't know where we'll find that extra money in our budget. And I don't want to be back in a position where we're trying to decide if I can get treatment or my husband does. I do appreciate you being here today. Thank you.
Thank you. Oh, thank you, Chair. Thank you to all as well. Thank you for taking time to come down and daring to visit Florida, which sometimes is a little bit of a challenge. My name is Seth Grossman. I'm from Parkland, Florida, where I'm a husband, a father, not necessarily a boarder, and small business owner. I'm a licensed clinical psychologist who, most of the week, that's my job. I also have a couple of other writing gigs and various things that kind of piece together what becomes what sustains us. And yeah, ACA has become extremely important to us. I think starting out when ACA was first introduced, when all the political rigmarole of 10,000 or so news cycles was around, I was so excited to see John McCain, a very principled Republican, walk to the floor and put thumbs down. What a difference that made to so many people. But at the time, it wasn't affecting me directly. And as much as I appreciated it, I didn't know exactly what was going to be in store coming down the line. A couple of years later, out playing with my son, all of a sudden I started to feel things that I had never felt in my chest, and held it together as much as I could before I said, I need to go to an emergency room, and was lucky enough to get to an emergency room that was able to take me right away. One of the things I was thinking about as others were speaking, when that becomes overcrowded, who survives?
That's right.
Who survives that? I was very lucky. I avoided a heart attack. It was an LAD, which is a widowmaker heart attack, and I got there just in time. I was scheduled to go to a professional conference in which I would not have survived, and I would not have survived in a crowded emergency. So that introduced a period of time where I now became a chronic health patient, somebody with chronic heart disease. Compounded then by diabetes as well. That all kind of showed up the same time as it showed up, both of my parents, 49 years old. So that's our new challenge. And then about a year later, my wife was diagnosed with breast cancer. Fortunately, one that was treatable, fortunately, one that she was able to access quality health care. Somewhere around this time as well was a time where my wife's current employment had ended, and we needed to find some way to cover health insurance. Most obvious choice, ACA. Even at that time, very expensive. More than we were used to with an employer-based health plan, but we made it work. We figured out exactly how. And then our son was diagnosed with autism. And people that have experience of that know that some of what the needs are covered, many are not. Additional money out. But we're making it work. And not lost on me is the fact that we have resources. We're not rich by any stretch, but we were able to do what we were able to do. And this was starting to really stretch our budget up to the point where we were at $3,000 a month this past year.
How much?
3,000. Yep. And on Saturday, I noticed that it was going up to 4,500. So it's a jump from $34,000 a year to $54,000 a year to cover health insurance. And many of the policies on the exchange, as low as you can get for a premium, and this, prior to this, it was with a subsidy, no, it's not. That usually increases your deductible, and that's more money in the pocket. Somehow, some way, we can make it up to this point. I'm not sure what we're going to do next. We're looking at a number of options, one of which is trying to figure out how we're going to put that out there. How much? $4,500 a month is more than our mortgage, more than the rest of our expenses.
How much do you pay for that battery? Oh, try to cover that.
Oh my. That's seeing patients around the clock. Yeah, it really is. It's increasing that part. It's going to decrease my ability to do some of the other things that are supplemental that help us make our ends meet. So we shall see. Hopefully we can build something, and I'm hoping that we're able to make enough noise on this side of the aisle to be able to move it.
Thank you.
Oh, there you go. Elizabeth, there's a mic. What I'm just struck by listening to, what I'm so struck by listening to everybody talk is that, like, our healthcare system, as Elizabeth's saying, and Chris is saying, our healthcare system already is pretty broken for people. It is too hard to find the care that you need. It is too expensive to find the care that you need. Patients are suffering. Providers, there's a lot of providers in the room. Providers are struggling to get the reimbursement that you need. And I mean, the big insurance companies are doing great. The big, PBMs are doing great, but there's nothing that that Donald Trump is doing that is gonna lower the cost of healthcare. It's just gonna make it harder for people to pay for the costs that they have. I mean, you all are gonna be dealing with, people all over the country are gonna be dealing with this quandary of how to make choices. If groceries are up, healthcare is up, your utility bills are probably up. Those are like terrible choices to be faced with. Anybody wanna, I was like, I don't want to talk.
Yeah, that's gonna be a lot of juggling. So do you turn off your AC? It's 90 degrees, 100 degrees in Florida, probably in the winter, we get like 70. So are we gonna leave our windows open and just turn off the AC? Are you gonna sleep with your windows open in Miami-Dade County? I don't know. But yeah, these are things that, and groceries are ridiculous. You go to the store, you go with a short list, you can walk in there and you walk out. Because you can't even look at anything right or else. Just get your staples. So that's going to be a problem.
I want to pick up on that point, because we're here to talk about healthcare, and we should, because this is a crisis. But remember, a year ago right now, Donald Trump is running for office, saying over and over and over that he would lower costs on day one. On day one. Those were his words, not our words, his words. And after he got elected, the very first interview he gave, the reporter asked him, why do you think you won? And he said, because I promised to lower costs on day one. So now here we are, 10 months in, and cost of groceries is up. Utilities, I was just reading, cost of electricity is up 11%. That's a lot of money, especially in a place where you're going to use air conditioning much of the year. Your utilities are already high, right? Cost of real estate is up, so people are paying more on rent. And what do the Republicans want to do? What does Donald Trump want to do? He wants to say he's driven prices up high already with the tariffs. Now they want to just shoot them through the stratosphere on healthcare. They want to drive up the cost, so some people just have to give up altogether. And so other people who literally cannot afford to give up because they have pre-existing conditions, they know they've got medical problems, end up spending a bigger and bigger and bigger portion of everything they've got just to get their healthcare coverage. This is taking hardworking people in this country, people with jobs, people who are out there doing their dead level best 7 days a week. It's taking those folks who are already working hard to make those budgets, just like you were talking about, Seth, to pull them together, and now just mashing them flat against the wall and say, there's no way you can make the numbers add up. And that's not going to be for a handful of people. That's going to be for millions of people across this country. We are in this fight because, by damn, we believe government should not be there just to work for a handful of billionaires and billionaires. They don't have to be there to work.
Thank you guys for, yeah. Well, this is what I want to ask you about. I mean, I'm just so moved by all of your stories. And Garrett, thinking, you've got how many children as well? You've got 4.
We have 4 children, one of whom has a genetic neurodevelopmental disability. So we spend a lot of time going to therapies with her. It's a job in itself.
In and of itself, and you're describing this horrific set of decisions you're going to have to make, deciding whether you get care or your husband gets care, and the impact that has on you, but the impact that has on your children. One of the, we're in this fight right now, and I've heard people, calling from the audience to hold the line. And one of the things Republicans are saying to us is, well, let's just put this conversation off. Trust us. We'll talk to you about this, a couple weeks from now, a couple months from now. Just give us your votes for this immoral budget, and we'll talk to you later on. when I listen to the three of you, it doesn't sound like this is a crisis that we can solve 6 months from now, right? I mean, for all of you, just if you have to pay these premiums next month, the month after, it's going to cause you to make decisions that could fundamentally change your life. I mean, just maybe say a word about why this is an important fight for us to win right now, and to not trust people who tell us that they're going to talk to us a couple months from now about maybe solving a piece of this problem.
So myself personally, I have CT scans and oncology visits scheduled out that, I mean, they can wait, I guess, but if they do, what happens to me? I'm just there for my children and my husband. And if you wait and we lose our health care, I won't make those visits. I won't be able to follow up, and I don't know what happens after.
Speaking about another theme with having a special needs child and having someone who is going to have to be responsible for beyond your own existence. With you putting out this kind of money, is there any possibility that you're going to be able to provide any kind of assistance moving forward? How's the next generation going to do it? Be virtually impossible. These are some of the talks that my wife and I are having right now as to how we're going to not only make all these challenges come to fruition in some sort of a way, but how are we going to be able to assure that a boy who is likely not going to be able to be entirely independent? He may do pretty well, but the likelihood is he's going to need support. How's that possible?
When you have to put this much more money into the premiums, it impacts almost everything else.
It impacts multi-generations, it impacts everything we've been talking about: food, about utilities, about just living life on a daily basis.
But it's the same fight over values. Are we a country that thinks it's more important to give $1 trillion in tax breaks to literally the richest people on the planet? Or are we a country that thinks we need to invest in healthcare and we need to invest in the care of our children? Now, I just got to throw this one in because you raised it. Donald Trump right now and the Trump administration are ending the department at the Department of Education for special needs kids.
Yes.
What kind of a nation
Yes.
says there's billions of dollars for Argentina, there's trillions of dollars for American billionaires, but there's no money for our special needs kids to be able to get the support they need? And I'm just going to do one up. While they're kids and while they're adults who continue to need support throughout their lives, this is about our values, ultimately. That's what this fight is about. It's about who you think our government, the one we elect in a democracy, who you think our government should be out there to fight for.
You know, I'm thinking about some of the things that I hear in the halls when I'm back in Washington, DC. And one of the things, I'm just wondering if you want to respond to this. One of the things I hear from some of the reporters is basically some version of, well, if you don't agree to give your vote to the Republicans on the shutdown, then millions of people are not going to be able to get their nutrition assistance. And so let me just ask you all, do you think that we live in a country where the only choice we have is a choice between kicking millions of people off of their health care on the one hand, or kicking millions of people off of nutrition assistance on the other hand? I mean, is that the only choice that we have in this country? I don't think so. I don't think so. That's what they're trying to tell us, that we need to just, that's our choice. And I mean, we are better than that. We could do way better than that in this country. And I mean, the stories that you're telling us about what impact this has on your lives, I think, are inspiration for all of us to continue this fight. Because, I mean, there's a big part of what's going on right now, which is these folks, Donald Trump, here we are in his backyard, no accident. wants us just to believe that there's really not that much we can do about this. That we have to just sort of accept it and give up and move on and maybe just retreat back into our own lives. But everybody here today is showing with your presence and your power and your strength that you understand we have the strength to do something about this. We don't have to put up with this bullshit. We can do better than this. And so, yeah, yeah.
So Tina, why don't we ask everyone, I take notes. You can always tell. Give us the one sentence you want us to take back to Washington.
2 words, not so.
What's that?
Not so.
Not so. Not so.
Yeah, all right, that's good.
Here, what's the message? Says,
Elizabeth, I'm going to parrot you and just say, remember your values.
Great.
Who the hell are we as a nation to be even considering what seems to be like the overall power in charge? Sort of I'm going way over the sense, I know.
it's okay.
Maybe it's
That's good. That's good.
But that's it, who are we?
This is important on a humanity level. We are people. We're not just policy. This is affecting us on an intimate level, our ability to be wives and mothers. And it's important. It's important to keep fighting for us who will, our entire lives will change if this isn't passed.
This is a tough one because this covers so many angles. Every day, the everyday people, the people that build this country up, the backbone of this country. Right. Because we go out, we work 10, 12 hours a day. Some people work 14. Some of these folks they can work 20, 24 hours a day. So, yes, for the average American, let's say that.
Don't get Great Gatsby parties every Saturday nights.
I think we're at time.
I have something to ask. I'd like to know how long is it gonna go on? Because I appreciate everybody here, but you all keep forgetting about federal employees. Senator Warren, you have 80,000 federal employees. Senator Murphy, you have 62,000. Senator Smith, you have 30,000. Florida has 327,163 federal employees and annuitants. And you seem to forget that we're in this too. You all need to get some knowledge about what is happening to federal employees, because as he fires us, a lot of us are not eligible for retirement. So when we retire, we lose and we don't meet the requirement. We are penalized 5% for every year. Now there's a first supplement for those of us who are retired before Social Security, but you got to be at least 57 to get that. So now you have federal employees who are going to be losing their money, their income, and with the health care, we may not be in Obamacare and the Affordable Act health care. However, we can't pay for our health care either. So while we are, and I have a son that's covered by ACA. However, I don't want you all to forget that there are federal employees too.
So let me just say on this, we all voted for all the federal employees to be paid.
Yeah.
Every single Democrat voted for that and every single Republican voted against it. So the people who are forgetting are the ones who want to forget, and that's Republicans. And the second thing is, you want to talk about what Trump is doing, firing people right now. Remember, long before the shutdown, he was illegally firing people.
Exactly.
We've got people in one agency after another, USAID, Consumer Financial Protection Bureau, Department of Education, federal employees who've been illegally laid off by the President of the United States. Look, we're not here to beg the President of the United States to follow the law. We're here to say it is time for the President of the United States to follow the law.
My question is, and I'm not asking you to beg.
Yeah, you
for
want to know when is this
No,
gonna
I'm
be, when is this gonna?
asking you, how long do you think this is going to go on?
So listen, as you know, the House of Representatives has been boycotting Washington DC for a month and a half. This could be over tomorrow if Donald Trump decided to come to the negotiating table. If House Republicans stopped hiding, right? We're there every single day. We are ready to end this tomorrow. But we just don't believe, as we've said over and over, that you have to make a choice between following the law and paying our hardworking federal employees and protecting the people that you just heard from not just financial ruin, but life and death ruin. So Donald Trump wants us to believe that, we can only do one thing at a time in this country. We can't feed hungry kids and save families from healthcare ruin and protect our federal employees. No, we can do all of these things. We can do all of those things. And this shutdown will be over the minute that Donald Trump and Republicans decide that they're serious about coming to the table and fixing this. So yeah, we're fighting on all fronts. We are fighting for federal employees who have been targeted and shamed and bullied and scapegoated by this president. Thank you for the work that our federal employees do. We're fighting for poor kids that are right now wondering whether they're going to have food on the table next month because Donald Trump is illegally refusing to fund the food stamp programs. And we're fighting for all of you who deserve a government that puts your health care before the billionaires and the millionaires and the corporations. So yeah, we're doing it all.
Okay, so when,
I want to thank our senators especially for taking the time to join us, for being patient listeners, for being a part of this conversation, for our storytellers, for really letting us know what's at stake. And I'm struck by this conversation, even where we landed, right? It feels like a fight between false choices that aren't really choices that we're supposed to be making. Like, that's not the fight. And I think where, they want to stand up is figuring and fighting with each other and picking these fights, when really those aren't the choices in front of us, when we can do all of it and take care of each other as people, as a community, as Americans. But yeah, again, I can't thank you all for tolerating my little song and dance show at the beginning. Martha, thanks again, SEIU, for having us. Thank you.
We're gonna